Hello everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS. So let's just move on to the last lecture of the counseling category, that is the learning disability. And this particular scenario is not very commonly tested, but in the recent times, we have seen a couple of recalls in which learning disability was one of the cases. And it is very important to discuss because yes, it's a counseling station, but in a patient of learning disability, you would have to exhibit your highest level of your counseling skills, because the main purpose of the counseling session is to make a particular patient understand and make a particular patient, uh, comfortable enough to agree to what you are saying and to make sure that their concerns are addressed. But the problem with people of learning disability is that no matter how good you try to be, no matter how um balanced kind of a counseling you are doing, and no matter how much you try to make them understand, because of the learning disability the message will not be conveyed across as efficiently as it is transferred to a patient who doesn't have a learning disability. Okay, so therefore, like, it's really really important that you are well aware of the tips and the tricks, and you're well aware of how to typically go about the consultation when it comes to dealing with patient with a learning disability. Okay, so before I jump onto the structure and before I jump onto the uh, way that you need to go about it, I just want to share a few tips that are like really really important. Okay, first of all, as you can see on the case note, it would be written, it would be very clearly mentioned that the patient has some learning disability. Okay, or if it's not mentioned, then when you'll do the opening statement, then the patient may just tell you, the doctor, I do have some learning disabilities. Okay, so in a patient like this, it's like really really essential, and it's like really important that you are able to number one, understand that the patient of learning disabilities are slow learners. Okay, so if you're explaining something, if you're trying to teach something, if you're trying to make them understand something, you may have to repeat a particular thing like multiple times, because they are slow learners and it would be difficult for them to understand and difficult for them to process a particular thing in very first go. Okay, number one. Number two, they have a difficulty in comprehending things. So always make sure that whenever you are dealing with a patient of learning disability, make sure that your tone is very slow paced throughout the session. Like for example, if I normally speak like this, then for a patient of a learning disability, I'm going to lower down my tone, and I'm going to say, very important thing is that the patients of learning disabilities are slow learners. Okay, so that is the difference. Like for a normal patient, you're just gonna say that patients of learning disability are slow learners, but in a patient of learning disability, you gotta make sure that your tone is very very slow, your conversation is very slow paced, and you're spacing out the words and you're not going very very fast. Okay, number two. Number three, you're not supposed to use complex terminologies. This is the rule. This is a golden rule for PLAB 2 generally as well, but specifically for patients with learning disability, you are not supposed to use complex terminologies. Like for example, you cannot say that there is a blood clot formation in one of your blood vessels. Okay, even though it's very very simple, it's in layman terms. Okay, but you would still need to offer some explanation or the other. Like for example, if you want to explain blood clot formation to a learning disability patient, you're going to say that there are pipe like structures called the blood vessels which are there in our body, and those pipe like structures are also present in our heart. The blood clot formation is such that a stone or any piece of object gets stuck into the pipe. So you understand, the pipe gets obstructed, the pipe gets closed, as a result of which, like, the water cannot flow from the pipe. Similarly, the blood will not be able to flow through that vessel. Okay, so you get the difference. Like, even though, just explaining and talking about a blood clot, okay, not saying thrombosis, you're not saying embolus, you're just saying a blood clot. But even then, for a learning disability patient, even the blood clot, may become a complex medical terminology. Okay, so you may have to, break it down further into much more easier examples. Okay, then I mentioned it before as well that you may have to repeat important statement because they are slow learners. Okay, then you need to keep on asking them if they are able to understand what you are saying. Okay, you need to constantly, provide them the reassurance that you are not going to go very fast, and you're going to make sure that they understand a particular thing, because they are under immense pressure to, understand a particular thing. Okay, and they think that, okay, the person is just going to say what he wants to say, and they're just going to go away without confirming with us that whether or not we are able to understand a particular thing or not. Okay, so make sure that you keep on asking, are you following me? Do you want me to repeat it for you? Are you able to understand what I am trying to say? Can you please repeat what I said for you? Okay, so very important and a very essential thing. Uh, then give the examples as if you're trying to explain a thing to a school going child. Okay, and this is the example that I just shared, the blood clot and the blood vessel example. Okay, you need to further break it down into much more simpler things. Okay, then offer to, remind methods to, ensure compliance. Like, for example, in the management part, I'll just share with you a few important things, but, make sure that, you have the approach of um, giving them the options that will help them, ensure compliance, that will help them remember what you said, and that will help them remember the medication and the treatment that they need to follow. Okay, so yeah, this is what are the key tips that you need to follow. Okay, and then last but not the least, do not ask compound questions, because we often end up, asking two to three questions in just one sentence, and it is not something that is also appreciated in like normal ability patients, but specifically in the learning disability patients, this thing, will have a very very significant impact, because if you end up asking two to three questions combined, then this particular patient would, become very uncomfortable, and they would be like, doctor, what are you trying to say? I don't understand what you're trying to convey. Okay, so they would just be taken aback. So never ask compound questions. So this is something that is not recommended at all in flap 2, but it is further, like, not appreciated when it comes to dealing with patients of learning disability. Okay, now let's just go through this particular case. There are, I think, three cases in which the patient of a learning disability comes to you. One is diabetes, other is the clot formation case. Okay, and I think there's another case I would just have to see, but yeah, two to three cases of learning disability. We are going to do the diabetes case. Okay, uh, so when you begin the case and when you ask the concern may be, and most likely it is going to be, that the doctor who spoke to them last time was going too fast and they were not able to understand what they said. Okay, so a diabetic patient would not be complying to the disease. Okay, the diabetic patient having learning disability, they will not be complying to the medications. Why? Because the doctor who spoke to them last time went too fast and they couldn't understand what they were saying. Okay, so that is what the concern would be, and then you have to, adopt a very reassuring tone that, okay, no problem, I understand that particular interaction with the doctor might be very overwhelming for you, and I do understand that you must have not understood what they said, but trust me on this, I'm here to help you. I'm going to make sure that I explain each and everything to you in a very, very detailed way, and make sure that I don't end this conversation until you have understood each and everything. Okay, slow tone, spaced out words. Okay, and then you gotta follow the same format. Okay, you're not supposed to lose the format just because it's a learning disability case. Ice, the idea about diabetes. Okay, you gotta ask about that. Okay, do you have any idea what diabetes is? Okay, and they're going to say that, oh, I don't have any idea what diabetes is, or they may say that, we have an idea what diabetes is. And then you're going to ask, do you know what causes diabetes? Okay, so risk factors. So instead of saying, do you know what are the risk factors of diabetes, say, do you know what causes diabetes? Okay, and then what have been told to you about your condition so far? What are the things that you remember from the last conversation with the doctor that you had? Okay, to explore about the ideas. Okay, because we need to stick to the format nevertheless. All right, then comes the essential data gathering questions. Okay, it's very simple. We have to stick to the same formula. Okay, I'm just very quickly going to go through all of these things. Uh, so exploring the situation and exploring the symptoms, you just got to explore the diabetes, talk about polyuria, and how you're going to ask about that. Do you feel that do you feel that you have an increased need to go to the loo, or are you going to the loo more often? Okay, do you feel that you want to pee every time? Okay, just try to make it very simple for her. Then polydipsia, that do you feel more thirsty? Are you drinking more water nowadays? Okay, and then weight loss. Have you noticed any weight loss? Do you feel that your clothes are becoming loose? Okay, so instead of directly asking weight loss, you can much further simplify it by using the clothes example. Okay, so that is what assessing this symptom and exploring the situation means. Okay, then the risks. Okay, this is the most important thing. This is the cornerstone of this particular station. Okay, you should be able to uh, explore the risks associated with these people, that is their learning disability. Okay, why they are having the problem? The only reason why they are having the problem is because of their learning disability. If they wouldn't have the learning disability, they would have understood what the doctor said previously. Okay, so there are a couple of questions that you need to ask when you are exploring the learning disability, and I'll tell you what those questions are. Number one, can you please tell me what kind of learning disability do you have? Okay, that is the first question. Yeah, doctor, I have autism. Yeah, doctor, I have Down syndrome. Okay, so like it can be any kind of learning disability. Do you have difficulty in reading or writing? Why is this question important? Because you cannot give written prescription to a patient of learning disability who cannot read or write. Okay, so make sure that you ask this question before ending your session, and ending up giving a written prescription, because people like these, who are unable to read or write. Okay, they would not be able to understand what you have written, or what is there in the prescription. Okay, so this question is like really, really important. Then, do you have any difficulty in understanding or remembering things? Okay, so in this patient you cannot give a written prescription. Okay, and if they have a problem in understanding, and if they have a problem in remembering things, you cannot even just make them memorize, and just verbally say it, say the prescription out loud, and expect them to follow the prescriptions. Okay, so you got to ask about this question as well. Other than that, there is a very, very specific question, okay, that you can ask, that do you have a hospital passport? Okay, it is typically given to those patients who have learning disability. It is an NHS thing, and it contains the details about what the learning disability is, and it's for the healthcare providers to make them aware that, okay, this patient has learning disability, so that specific arrangements can be made, and specific assistance can be provided to these patients. Okay, so do you have a hospital passport? All right, very important question. Then the third parameter is exploring the red flags. Okay, and it's like really simple. You can just talk about the red flags of diabetes, because this patient had a learning difficulty, as a result of which she was not complying to her medications. Okay, so you just can ask about the red flags of diabetes, that any problem with the vision, that means you're trying to rule out the possibility of diabetic retinopathy. Then you can talk about any problem with the urine to rule out diabetic neuropathy, sorry, nephropathy. And then you can talk about numbness and tingling to rule out diabetic neuropathy. And then you can ask about severe life-threatening conditions like DK, in which you can ask about abdominal pain, nausea, loss of consciousness. Any of these symptoms would indicate that the patient may have had an episode of DK as well. That means her sugars are like really really uncontrolled. Okay, and then hypoglycemia is another complication of diabetes that you may ask by asking about palpitation, sweating, loss of consciousness and all. Okay, so yeah, the red flags like are really, really important, and the red flags are usually disease oriented. Okay, and not exactly learning disability oriented, because learning disability is just exist, and there wouldn't be any major red flags in the learning disability. But yeah, you may just ask that, have you had any problems because of your learning disability? Okay, so just one question to make sure that you're touching about the red flags and the complications of the learning disability. Okay, then psychosocial aspect is like it's extremely important in these patients. Okay, like who is at home, who do you live with, what do you do for a living? Okay, like these are like really important question, because these are the people, these are the group in your society that needs specific attention, and they need a good amount of support. Okay, so like asking this question is like really important, and you've got to explore the psychosocial aspect in the learning disability patients in detail. Okay, then in the dexamethasone, you may just ask about the medications and assess the compliance of the medications. Okay, that uh, when do you take the medication, how do you take the medication? Okay, and when you ask this question, you will get to know that this particular patient is not taking the medications all right. They're going to say that, doctor, I only take the medication when I feel that I'm not feeling well, or I only take the insulin, or I only take the injections whenever I eat fast food. Okay, I don't take it every day. Whenever I feel that I've eaten a lot, then only I take the insulin. Okay, so the medication compliance that would be lacking, primarily because of this issue, that the doctor was too fast and wasn't able to explain the use and how to use the medication. Probably that's why the compliance would be an issue. Okay, so this is something that you would get positive. Okay, and then you may just offer uh, examinations. Okay, like for example, you may offer a GP examination. Okay, you may want to do a fundo scopic examination. Okay, you may just want to do a neurological examination to make sure that there is no complications involved. Okay, so just name the relevant investigation and you'll be good to go. Okay, so the questions are like the same, the pattern is same. Okay, just an additional exploring of the learning disability when it comes to exploring the risk is mentioned. And again, it's up to you if you want to explore it over here, or if you want to just add an additional point of exploring the concern, and then if you want to just ask about it in the box one word. Okay, it's completely up to you. Now the explanation part of it, is like really really important, because the patient has learning disability, and you need to be on the top of your game to make sure that you are able to explain the situation to this particular patient in a very 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 clear and understandable manner. Okay, so you're going to say that, you're not going to say that you are having diabetes. Okay, they would not understand that. Okay, what is diabetes like, and you would get an idea when you're assessing about the ideas that do you have any idea about diabetes, and they would say no. So you got to explain that when your blood sugar gets more, that is due to you not taking the medication. That condition is called diabetes. Okay, in very easy and as simple terms as possible. Okay, now comes the difficult part, explaining the insulin. Like for example, they need to take two insulins. Number one, actrabit, which is the short acting insulin, and number two is the long acting insulin called the lantus. So you're going to one by one take it up, and one by one going to explain it in a very very detailed manner, and in a way that it's understood by someone having learning disability. Okay, so you're going to begin with short acting or act rapid. Okay, you're going to say that this is one insulin, and they would be they would give you the like vials that would be present over there, so you can just show it that okay, this is what act rapid is, and this is what lantus is. Okay, hold it and in your hand, and then tell that okay, this is something that works for a short duration. That's why it is called short acting. Short acting, short duration. Okay, and this needs to be taken 3 times daily. How many times? Can you repeat after me? 3 times. One, two, three. Okay, like act as if you are dealing with a child. Okay, and every time it needs to be taken 30 minutes before the meal. 3 and just add a 0, that makes it 30. 30 minutes before the meal. Okay, that is how you're going to explain it. Okay, but that wouldn't be enough. So what you need to do is that you need to try to find the things that they do before the meal, and try to use some strategy or the other to make sure that they are able to remember it, and they are able to comply to it. Like for example, you usually the act rapid vial is yellow in color. Okay, so you're going to say that this is yellow in color. Okay, and so is the sun is also yellow in color. Okay, and this particular medication is also yellow in color, so it means that you have to take it during the day. Okay, the daytime. And just assume that this insulin or this particular yellow insulin is best friend with your meals. Okay, you see how I am bringing up the things that I'll bring up with a school child or with a school going child. So this is best friend with your meals, so you have to take it with the meals. Okay, so if I would to just tell her that okay, you have to take it with the meals, she may have not understood what it meant. But since I've connected it to the sun color, that means that the daylight is yellow, so you need to take it in the daytime. Okay, and this is best friend with your meals, so you need to take it every time with your meal. Okay, so I have made it much easier for her to understand this thing. Then comes the lantus, which is the long acting. Okay, so you gotta tell that okay, this is a longer acting. Okay, L for long, L for lantus. Okay, and this needs to be taken at night. Okay, now what you're going to do? You're going to ask them that okay, what do you do at night? They're going to say that okay, I watch a show, or I call my grandma, or I try to read a book. Okay, so just connect that particular habit that she always does every time. Okay, and just try to link it up with the medicine. Like for example, let's suppose that you watch a show, so assume that this insulin is best friend with your favorite show that you watch. Okay, just assume that this is best friend with the favorite show that you watch. Okay, secondly, it's a dark blue in color, and usually the lantus vial is dark blue in color. Okay, so dark blue sky is also there at night time. Okay, so compare it with the color of the sky. So this would mean that okay, since this is also dark blue, the sky is also dark blue, and it is best friend with your show that you watch at night. So that means that you have to take this insulin during the night time. Okay, So you have to use these scenarios, you have to use the situation like this to make sure that they understand, make sure that they're able to remember this thing. Okay, it's not easy, it's difficult, and where it gets challenging is because of the time management. It would be very difficult for you to manage your time. It would become extremely difficult for you to manage your time, because you would have to speak slowly, you would have to constantly repeat a lot of things. Okay, and at the same time you would have the pressure to cover each and every topic, cover each and everything as well. So you gotta make sure that you are on the top of your game and you've practiced this particular type of session like really really well in a lot of detail. Okay, then the patient may just drop the concern that should I take insulin only when I get sugary food. Like for example, I told you in this when I was teaching the DASA and the meftosa part. Okay, so you got to say that no, it has to be taken every day. And what important thing that I want to share, the advices. Okay, like there is no counseling session without proper advices. Okay, so I'll just share a couple of advices that you need to give. The number one, you need to give the basic advices that you need to avoid sugary foods like donut, sweets, candies, and desserts, and see if you can exercise or not. Okay, so these are like just basic advices. But these three advices are the real deal. Okay, these are the three advices that uh, you should make. Okay, like for example, number one, write the reminders on a refrigerator or a door. Okay, what will this do is that whenever they open a refrigerator, whenever they see the door of their room, they would remember that okay, they will have to take this medication at this particular time. So constant reminders. Okay, constant use these tips and tricks to make sure that the patient is constantly reminded to take their medication. Number one. Number two, try to set alarms on their phone. Okay, the alarms on their phone would act as reminder when it will just ring, and then they would know that okay, now is the time to take a medication. Okay, so I'd give these advices, ask for their phone, and make sure that you are providing this option of setting alarms on their phone. Okay, then there is a thing called the pictorial leaflet. Okay, so what is a pictorial leaflet? Is basically it includes pictures, diagrams, animations, to help a patient remember a particular disease, a particular medication advice. Okay, and these are what is called the pictorial leaflets. And why are they important? Because these patients may have difficulty in reading or writing. Okay, so if you give them a written prescription, it may not be very relevant in their case. Okay, so you may want to ask about, and you may want to give the option of providing them with pictorial leaflets. Okay, then one thing that you can offer to them is that diabetic nurses, or or coagulation nurses, if it's the case of blood thinner, then you can offer that these nurses can come and visit you, and they can ensure that you are taking the medications on time. Okay, so this is a service that can be provided, that nurses can go and visit them in their homes, to make sure that they are complying to the medication. So all of these things are like available. These are the facilities that are available, like pictorial leaflets, home visits by the nurses. Okay, so try to use all of these situations. So if you are following the key pointers, um, like these, like what keeping a slow tone, not using complex terminologies. Okay, and not asking compound questions, making sure that you explain things in this way in which you use the patient situation, and you make it very 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 simple for the patient. Okay, and at the same time when you're giving advices like these, so if all together if you're able to do all of these things, then you should be good to go. Okay, and the case of the learning disability, it would be managed very very easily by you. Okay, so you wouldn't have to worry about it. So make sure that you have studied and you have read all of these cases, and make sure that you have practiced these cases as well, because if they might show up in the exam and if you're not prepared, it can be very difficult to go through it and go and make sure that you cover it within the required time limit. Okay. Really important cases very rarely shows up, but if you are unlucky and if they show up in the exam, then it can get particularly difficult to manage this situation. Okay. So follow these tips and tricks, and make sure that you've practiced well. Make sure that you have studied all the case notes of the counseling session, and make sure that you have following the four box approach, which I just taught, inspired by, of course, Dr. Lovaan. And good luck with all the counseling sessions, because they can be particularly difficult, and they would require a lot of practice and lot of reading as well. So that's it. That's pretty much it from my side. If you got any questions and any queries, drop them down in the comment box or reach out to us on our social media. I would love to address all your concerns. Thank you and see you in the next lecture.